The purpose of this short video is to tell you about my upcoming transition from full-time practice to part-time office, and more importantly, to thank all of you who have put your trust in me during my career at Virginia Cardiovascular Specialists. About 2 years ago, I began exploring the option of quitting full-time practice. It's not because of COVID, and it's not because of any dissatisfaction with my work or my career in cardiac electrophysiology. Rather, it's a wish to be able to devote more time to other interests in my life, to see more of my large extended family in Ireland, and indeed to still learn more about other areas of cardiology by making this transition. So working with our group over the last 18 months, we have identified an excellent young man, Dr. Michael Rehorn, to take over my full-time role at Chippenham Hospital and the Stony Point office. And we have planned what I hope will be a smooth transition. I finish up full-time hospital and procedure work in August this year, 2022, and all the details work out. I begin part-time general cardiology office work at our Tappahannock office in the Northern Neck in October, working for 3 days a week, every other month in a job-sharing arrangement. Dr. Michael Rehorn starts in August, originally from Charlottesville, with undergrad at UVA, med school at Northwestern, residency in Harvard, and now finishing cardiology and cardiac electrophysiology training at Duke. He's an outstanding young physician, and I am leaving you in capable hands. I've already spoken to many of you about the transition to seeing Dr. Rehorn at the Stony Point office. And I've also spoken to some of you about the opportunity to transition to one of our other excellent cardiac electrophysiologists who are at offices that may suit you better geographically. So Dr. Bowie, Barry Bowie, trained in Harvard. He's in his third year with us. He's at our Hull Street office at Harborside. Dr. Vivek Master, trained at VCU, also in his third year with us, and he covers our Prince George Colonial Heights office on Puddleduck. Dr. Joyner, my long-standing partner, remains Southside at Stony Point and Hull Street. And then for folks living on the West End, you might wish to see Dr. Ricky Sani, our young partner at Forest. Dr. John Onifer is our senior partner at St. Mary's. And finally, on North Side, Dr. Dan Snyder is at our Bell Creek office and Memorial Regional. I can wholeheartedly recommend any of these cardiac electrophysiologists to you. And finally, I will be available at the Tappahannock office for a few who might find it suitable to continue to follow with me there. So, when I considered whom to thank as I make this transition into the latter part of my career in medicine, it just became clear to me that the most important people to thank are you, the people who have been my patients, who have put their trust in me over these years. To that end, I actually hope to do an in-person appreciation event, and we looked at various formats, we had looked at possible venues, but ultimately the presence of COVID did affect this plan. I felt that it might create a risk by bringing together a group of potentially vulnerable people indoors this summer, and the last thing I would want to do would cause any harm. So instead, you're getting this video message. I do want to thank each and every one of you who has entrusted me with the care of your heart over all or part of these past 21 years that I've been at Virginia Cardiovascular Specialists. Many of you are referred by other physicians or other patients or friends, maybe from your church, or many of you just met me in the ER or the hospital. But all of you put your trust in me, a privilege and a responsibility which I've always taken most seriously. You took my advice, usually, on all matters, both big and small, in looking after cardiac arrhythmia problems. Many of you trusted me to perform implants of cardiac devices and do complex catheter ablations on your hearts, procedures which can carry serious risks, and again, a responsibility I've taken very seriously. Hopefully, my care by and large has helped you and hopefully not done harm. Sometimes things have not worked out as well as we would have hoped, and sometimes I may not have lived up to your expectations, and for that I apologize. But know that I always had your best interests at heart. So from the bottom of my heart, I thank you for having placed your trust in me, and I thank you for your loyalty. Please always stay as active as you can for as long as you can. Eat healthy and live life to the full. Thank you.